One love, one heart, let's get together and feel alright. I was invited to go to Cape Town, South Africa, to talk about conducting community-based participatory research to address HIV and AIDS. But what happened is I was reflecting on the townships where the people were very poor, the blacks in Cape Town. And I looked in the audience and I didn't see any of those persons there, those who were living and experiencing that. And so I got up to give my talk and I didn't give it. And I shared the words that were dancing in my head and my heart. And the audience joined in, and everybody was crying. They got it, right? We had left out the most important people. And so that's really what started me on the journey in terms of my approach to addressing health disparities and to all of the work that I do.
I met Dr. Tucker through my church, which is Bethel Baptist Institutional. She came to our church to introduce a concept with regards to Health Smart for families.
The idea, number one, of having an ongoing program that worked directly with individuals who happened to be partnered with churches, and the idea of building long-term relationships with pastors and churches. That kind of thing was not common at that time, still isn't today.
Her innovation really is to have taken evidence-based approaches to improving nutrition, improving exercise, working with communities to figure out the right language and the right way to describe those interventions in ways that seem positive and proactive, and then working with church communities as one example, like the church behind me. For the program to be successful and sustainable, she needs to recruit members of the community themselves to become change agents, and that's what she does really well.
Even though we've had different experiences, we're all similar, and we can share those things and be encouraged by it.
When I go to the doctor, I have a journal right in here that I open up and then know where I am, what's going on.
So she has done a wonderful job in giving us the courage to speak up to our doctors and ask questions from our doctors and just be empowered when we go to the doctor's office.
Dr. Tucker is a change agent, and she helped us to get over those first hurdles. And we've all stuck together. We're not under a grant now, and it's been about 18 months, all because of the seed that she planted, starting with Health Smart, and we're remaining Health Smart.
Yes.
Amen. Well, come on, let's.
Okay.
Food is a big thing in predominantly African American communities, and the idea of changing the way that food is seasoned and how food is prepared, I thought that was going to be like pulling teeth. It turned out to be the absolute opposite.
I think I'm just most proud of developing interventions and having community members to implement them to try to address the hypertension, the diabetes, the cancers that are disproportionately high in Black and low-income communities. And when I see, for example, Health Smart, it just makes me jump for joy. And it's being used nationally and internationally.
The evidence that has been produced by Dr. Tucker's research is indisputable.
I didn't just sing it in South Africa. I sing it at every one of our Power Over Cancer gatherings. And then I ask people to always have an ear for the beats of different hearts.